All right, awesome. So we just would like to put out this disclaimer now, but if you are currently experiencing any medical emergencies, please contact 911 and seek medical attention. This presentation is meant to raise awareness and is for informational purposes only. Next slide, please. Awesome. So this is the rundown of today's agenda. So today we're going to be talking about various types of visual impairments. We're going to talk about the background behind some of these visual impairments. We're going to talk about some statistical data, some behaviors and symptoms, struggles and challenges, resources and treatment, and accommodations for those who experience a particular type of visual impairment, which we're all about to find out right now, actually. So let's get into this. So next slide, please. So what is a visual impairment disability? So a visual impairment is defined as the limitation of actions and functions of the visual system. And we have that the National Institute defines low vision as a visual impairment not correctable by standard glasses, contact lenses, medication, or surgery that interferes with the ability to perform activities of daily living. Next slide, please. So here's a list of just some of the various types of visual impairments. So we have there are visual impairments like macular degeneration, cataracts, astigmatism, diabetic retinopathy, and glaucoma. And as you can see here, what we'll do is that we will give a brief background of the top four, but then as you can see down below, we have glaucoma in gold. Because for this presentation, we are going to be talking about more about glaucoma specifically and about how it can result in individuals developing, either potentially blindness or other various visual impairments. So next slide, please. All right, so before we want to go into the four visual impairments that were just previously mentioned, it is important to definitely highlight some of the aspects of the normal eye so that you all can kind of see as a contrast of, or more or less have a better understanding of what a normal eye is going to look like. But we'll also briefly talk about what various parts of the eye do. So as you can see here within these diagrams, you will see that there is a part of the eye called the lens of the eye, and that focuses essentially light that enters the eye and passes it on to the retina. We also see on the left-hand side, we also have the macula, which is the central part of the retina, and that accounts for central vision. We also have the retina itself, which is a layer of tissue, that transforms the light coming into our eyes into electrical signals, and that electrical signals get sent to the brain, and that allows us to essentially recognize images. We also have the optic nerve, which connects the retina and the brain together and transmits electrical signals formed in the retina to the brain as well. And so essentially, overall, as you can see here, that's kind of a bit of a rundown of the composition of the eye, essentially. And as you can also see within here as well, that I encourage you all to really look at these pictures and see that these pictures, this represents the normal eye. And so what we're going to do in these next few slides is that we're actually going to show you what happens to, or what becomes of the eye when someone is exhibiting the various types of visual impairments we previously mentioned. And then we're going to really go into detail with glaucoma. Next slide, please.
Thank you, Christian. So I think you guys can all see the slide. So the diagram, or rather the picture that's on the leftmost side, that is an image of a cataract, which is essentially a painless opacification of the lens, which leads to glare, which will decrease your ability to see. Now, the image in the middle is an eye presenting, with someone presenting macular degeneration. And this is an age-related visual impairment that is essentially the deterioration of your macula, which is, as Christian said, the central area of your retina. and this will lead to distortion and eventually loss of vision. And the image on the rightmost side is of diabetic retinopathy, which is also age-related. And there are two types of retinal damage, proliferative, which is when new blood vessels form on the retina, and then non-proliferative, which is macular swelling, which occurs due to ruptures in the capillaries. And the reason why diabetic retinopathy is particularly important is because it affects really large populations of people. And with that, we can move to the next slide. And so what you guys will see here is the diagram of a normal eye and an astigmatic eye. And so essentially what astigmatism is it's an imperfection in the curvature of the cornea, which will lead to uneven refraction of the light to the retina, which will thus lead to either eye strain, blurry vision, or both. With that, I'd like to hand it off to Nimrat.
Thank you, Rinisha. So now we're going to talk about glaucoma. Glaucoma is caused by an abnormal amount of pressure on the eye caused by the progressive degeneration of the optic nerve. So what is the optic nerve? The optic nerve carries the signals for sight from the retina to the brain. And as mentioned previously, damage to the optic nerve can lead to visual loss or blindness. And then as we can see in the first image on the left, we see the optic disc, which has a portion called the cup that is supposed to be smaller as seen in the normal eye. But when there is an increased pressure, the size of the cup increases, which causes damage to the optic nerve. And here on the second image on the right, we can see levels of pressure that can lead to vision loss. And those levels are mostly skewed to the right side of the graph. Next slide, please. So there are multiple types of glaucoma, but in this presentation, we are going to focus on primary open-angle glaucoma. And open-angle glaucoma, the fluid passes too slowly through the trabecular meshwork. This causes a buildup of fluid and consequently results in an increased amount of pressure in the eye. This pressure then causes damage to the optic nerve, and as we previously discussed, damage to the optic nerve can lead to visual loss or blindness. And if you look at the image down below, we can see the trabecular meshwork in a normal eye. And on the right, we see an eye with blocked meshwork, which results to a pressure buildup. And that can eventually cause changes to the optic nerve. Open-angle glaucoma is the most common form of glaucoma. It's usually silent and progressive nature makes it a worldwide health concern, as it is one of the leading preventable causes of blindness in the world. And next slide, please.
And to kind of give you guys some statistical data, this is just going to cover a lot of like the numbers that have to do with glaucoma. Glaucoma is the second leading cause of irreversible blindness in the world. It is also responsible for 11% of blindness in the US, and it is actually constantly increasing. So that number has increased in the last decade. And kind of to go over this diagram right here, this is just a specific breakdown of age versus gender, and then also just the number of patients. So as you can see, as as patients get older and older, we do have an increased number in glaucoma, and especially you can see that it doesn't really discriminate by age. Both are suffering tremendously from the same results. Mashall, if you'd like to add as well.
Yeah, so and then like we discussed in the previous slide, that primary open-angle glaucoma is one of the most common, but also about 15 to 27% of patients with primary open-angle glaucoma experience blindness in at least one of their eyes. Also, 20% of glaucoma patients are blind in at least one of their eyes, and again, majority of these patients are patients who have primary open-angle glaucoma. And in the figure on the top right with the world map, it shows the annual percentage change of blindness and the prevalence with blindness in glaucoma patients. And so this chart is from 1990 to 2017. And so the lighter green colors are the ones who are increasing, but at a slower rate. Darker blue is like they actually are decreasing. And then the yellow and reds, they're increasing at a higher rate. And so the greatest increase between these years was in Côte d'Ivoire, and our greatest decrease since 2017 is in Qatar. And we can go on to the next slide.
Hello, it's Yuping again. So let's talk a little bit about the behaviors and symptoms of glaucoma. So one of the most leading examples in terms of symptoms of glaucoma is an increase in average eye pressure, also known as intraocular pressure. So normally we have our intraocular pressure from 10 to 21 millimeter mercury. However, those pressures can actually increase up to 30 millimeter mercuries and beyond. So what's happening here is as the pressures in the eye increases, studies have shown that there is a correlation that relates this increasing eye pressure to increase in percentage of people who has those higher eye pressures being afflicted by glaucoma. So the other interesting thing, or I guess the other symptom of glaucoma would be a gradual decrease in the field of vision for a patient who has glaucoma. And this gradual decrease will occur throughout a patient's life, leading to a lifetime of treatments that a patient afflicted with glaucoma would have to go through. Now, talking about glaucomas, we have already mentioned the major type of glaucoma, which is open-angle glaucoma. Now, this type of glaucoma could be slow. So this patient could be experiencing a gradual decrease in vision as their vision acuity decreases over time for a long period of time. However, there's another type of glaucoma that is called acute angle glaucoma. Now, this type of glaucoma is a little bit more complicated, as in this glaucoma can actually has an immediate impact on a person's vision, where a very quickly developing case of glaucoma can happen, in which a person may have blindness in a very short span of time. And talking about the symptoms of glaucoma, we also need to touch on what does glaucoma feel or is like for a patient who has it, right? So if you look at this picture here of the streets and this blinding sort of blending lights on the top right, there it is. Some symptoms is actually seeing this rainbow color almost hue for a person who's afflicted with glaucoma and overall blurry visions. That's of course accompanied by a strickening of the field of view. So now let's go to the next slide and look at a little bit more interesting aspects of symptoms of glaucoma that's not necessarily relating to vision per se. So for someone who has glaucoma, we can also see a pain around the eye. So it could be a headache, or it could be a general area of discomfort all around the eye. It could be both eyes, one eye. There's a plethora of symptoms that can be observed. And an interesting aspect of this is a study has been conducted that shows the level of sleep. That means your sleep hygiene. So what is around you when you're sleeping, what is your sleeping position can actually affect your glaucoma, whether or not it progresses slowly or more quickly. Another thing that's interesting is light. So throughout the seasons, light will change. And depending on how you're exposed to these lights, it might also have an effect on the progression of this disease. Now, talking about glaucoma, we have to talk about treatments as well. So one of the major things that a study has found is that the interactions between patients and doctors plays a relatively large impact on the recovery, or I guess the improvements of the progression of glaucoma. So sometimes when patient receives medication, they don't take it, right? They sort of put it off and put it away, just like what we do with homework sometimes. We tend to procrastinate and not do it in general. And that's very bad for someone who's afflicted with glaucoma. So how do we improve that? How do we make that better? So one way that a study found is to have the provider remind the patients and talk to them about what the future of their disease might look like. Hopefully that will wake up this patient to the benefits of receiving treatments and provide them with more encouragement about taking medications. That, of course, includes reminding them by calling them from an office or on a personal phone from the doctor to just have a contact with this patient and making sure that they're doing the right things for their glaucoma. Now, on the very last section of this slide, I want to show you guys a little bit about what this decrease in field of vision kind of looks like. So we can see on the top, we have normal vision, and as we progress downwards, we have a more and more restriction in terms of field of vision, all the way until the extreme cases where it almost looks like you're looking through the periscope of a submarine. So that's what a patient afflicted with glaucoma will be seeing throughout their lives. And that is it about behaviors and symptoms. On to the next one.
Okay, so now we're going to talk about struggles and challenges that patients who have glaucoma deal with. So to start off, obviously, the more that a patient's condition deteriorates, the more costly their treatment and glaucoma management will become. And so glaucoma obviously directly influences the social as well as the financial or economic standing of patients who deal with the condition. And when we're talking about the financial or economic aspect of this, we kind of have to cover health insurance. And especially being, in the Inland Empire in Riverside County, health insurance is a big topic that's usually talked about. So a basic health insurance plan will only cover one eye exam every about 2 years, so 24 months. And typically it's an eye exam for glasses and or contacts. And so it's not necessarily very specific to different glaucoma conditions. On top of that, about 15% of Riverside County citizens are actually uninsured. So they don't even get that eye exam covered every 2 years. And also, there is a large undocumented population in Riverside County as well. And so people, who are not citizens, who are underinsured, this statistic does not take that into consideration. And so all those people who don't have the insurance they require for this actually will have to pay out of pocket for all their health costs that have to do with their glaucoma condition. And so this takes a really large toll on their social standing, as well as, of course, their economic and their financial situation as well.
Another struggle for glaucoma patients is difficulty driving. One study showed that a large number of people with very advanced visual field loss continue to drive after a previous collision, which subjects both themselves and society to increased mortality. Another analysis showed that glaucoma subjects had a threefold increase in the odds of a state-reported accident when compared to controls who didn't have glaucoma. One possible reason why glaucoma patients have difficulty driving is the fact that they have poor peripheral vision, which results from a higher than normal eye pressure. The last challenge we want to talk about are comorbid psychiatric disorders. Depression and anxiety are two of the most common psychiatric disorders in glaucoma patients. These disorders are actually not considered by eye care practitioners who commonly focus on the ophthalmic care of their patient. This disregard for comorbid mental problems imposes an extra burden on such patients who are already struggling from the visual problems of glaucoma. A neglect of disorders can consequently lead to worsening of the condition, a longer hospital stay, and increased costs of care. This will lead to wasteful and inefficient use of medical resources. Next slide, please.
Okay, so eye drops can help patients with glaucoma by decreasing the eye pressure by improving how fluid drains from the eye. So both prostaglandins and alpha adrenergic agonist increases the outflow of the fluid in the eye. So some examples of prostaglandins are latanoprost and travoprost, and some side effects include mild reddening of the eyes and darkening of their iris. An example of alpha adrenergic agonist is brimonidine. And then Beta blockers and carbonic anhydrase inhibitors both reduce the production of the fluid in the eye. So an example of beta blockers is timolol, and a side effect of timolol is difficulty of breathing and slower heart rate. And examples of carbonic anhydrase inhibitors are dorazolamide. And a possible side effect could be frequent urination. Next slide.
Next, we will be moving into the different types of surgeries and procedures that can be done in order to treat glaucoma. Our first surgery is laser trabeculoplasty or laser therapy, which is a procedure often performed if you have an open-angle glaucoma. This is often the first procedure performed before trying out other surgical methods. There are two types of trabeculoplasties: argon laser trabeculoplasty and selective laser trabeculoplasty. A selective laser trabeculoplasty uses a lower power laser in order to do this procedure. This procedure can be done in a physician's office and uses a small laser beam to open clogged channels in the trabecular meshwork. After this procedure has been done, it may take a few weeks before the full side effects of the procedure become apparent. You'll be prescribed additional medicine to take after this procedure in order to keep down the pressure in your eyes. You will have to come in for follow-up exams as recommended by your physician. Some complications can include brief inflammation of the iris, cloudiness of the cornea or the iris, which will go away eventually, blockage of the drainage angle where the cornea and iris stick together, pain, and decreased vision. Our second type of surgery is a trabeculectomy, a filtering surgery, which is a procedure done by a surgeon that creates an opening in the white of the eye or the sclera and removes part of the trabecular meshwork. This procedure can result in a small blister of fluid called bleb on top of the eye surface, but underneath the eyelid. You'll be prescribed additional medicine to take after this procedure in order to keep down the pressure in your eyes. You will have to come in for follow-up exams as recommended by your physician. Some complications that can arise is possible leakage of fluid from the surgical site, too low of pressure that can cause blurry vision, bleeding, eye infections, and cataracts. Our third surgery is a glaucoma implant surgery or a drainage tube implant, which is a procedure done by a surgeon that includes inserting a small tube shot into your eye to drain away excess fluid to lower eye pressure. There are two types of drainage implants: valves and non-valves. After having completed the surgery, it may take a couple of weeks for the pressure to stabilize. You will be prescribed additional medicine to take after this procedure in order to keep down the pressure in your eyes. You will have to come in for follow-up exams as recommended by your physician. Some possible complications from this procedure is corneal decompensation, tube erosion through the conjunctiva, infection, bleeding, cataracts, double vision, and possibly a second glaucoma surgery will be needed to be performed or have the implant removed completely. Our last surgery is a minimally invasive glaucoma surgery, or commonly known as MIGS, which is a procedure performed by a surgeon that has many different techniques that can be used, such as iStent, Ivantis, or trabectome. This procedure is preferred among surgeons due to its low complication rates, fast recovery, shorter operation time, and its great effectiveness post-surgery. This procedure utilizes the insertion of a tiny device that looks like a tube into the eye with a tiny incision into the trabecular meshwork to drain excess fluid into the outer membrane. You'll be prescribed additional medicine to take after this procedure in order to keep down the pressure in your eyes, and you will have to come in for follow-up exams as recommended by your physician. Complications may arise, but it depends on the MIGS technique that is utilized. Some complications are MIGS are stent obstruction or malposition, blood, and corneal injury. Next, please. Next, we'll be playing a short trabeculoplasty surgery.
With laser trabeculoplasty, your surgeon will put a special contact lens on your eye. This helps focus and deliver the light from the laser to the precise location. The surgeon applies the low-energy laser to the area called the trabecular meshwork. This is where fluid naturally drains from the eye. The laser causes microscopic changes in this tissue, allowing fluid to drain better and reducing eye pressure. Now, as with any surgery, there are possible risks with laser trabeculoplasty. Laser trabeculoplasty risks can include temporary or permanent increase in eye pressure, swelling of the iris, sensitivity to light, cloudiness of the cornea, blockage of the drainage angle where the cornea and the iris stick together, scar tissue forming in the eye pain, decreased vision, possible need for additional surgery, and permanent loss of vision. There are alternatives to having laser trabeculoplasty. You may be able to have another type of glaucoma surgery, or you may use eye drop medicine. Your ophthalmologist can explain why he or she chose laser trabeculoplasty to treat your glaucoma. You do not have to have laser trabeculoplasty for your glaucoma. However, without lowering your eye pressure, you may continue to lose vision. If it is left untreated or partially treated, glaucoma can lead to blindness. Treating your glaucoma is important for protecting your vision and your quality of life. If you have any questions or concerns about laser trabeculoplasty, ask your ophthalmologist. He or she will be happy to help you understand the risks and the benefits of this glaucoma treatment. Also, if you have any questions or concerns about your eyes or your vision in general, don't hesitate to bring them up. Your ophthalmologist is committed to protecting your sight.
There are several accommodations available for people with visual impairments and severe open-angle glaucoma. In a classroom setting, for example, teachers can minimize classroom sound and noise. They can outline lessons for students at the beginning of class. They can use familiar objects, reading out loud, and verbally describing things that are going on in the classroom. Teachers also encourage teaming up with peers for the student with the visual disability. They make readings and texts available for the student before classes. And disability note takers are available for the student to scribe whatever the student needs. Next slide, please.
So when it comes to a lot of visual impairment disabilities, not many people realize the difficulty that a lot of people with these types of disabilities face, especially in the workplace. So described below or on the screen are several types of scenarios that some people might be dealing with glaucoma. So for example, with the first scenario, someone at Allie is diagnosed with glaucoma. Even though they may enlarge the print on her computer screen, she may still have difficulty completing money orders and reading prepaid mail envelopes and shipping containers. So a common solution would be to provide her with a hand and stand magnifier. In the second scenario, we'll have that is commonly used would be the service dogs provided. And this can especially help when it comes to transportation for a person. And in the third scenario, we'll have the use of cubicle roofs and filters and fluorescent light fixtures, since a lot of people who deal with glaucoma may be very sensitive to light. Next slide, please.
Certain equipment are available for people with visual disabilities, and this is provided to them by their employers, teachers, and or their physicians based on the Americans with Disabilities Act requirements. Some of these equipments include a portable brailler, which you can see on the top left, talking calculators and watches, thermographic pen and paper, and an image of thermographic paper is on the top right. And this is essentially just paper with raised letters printed on it. Screen readers, which is the bottom left, and it essentially converts text into Braille. 4-track portable tape recorders, scanning text-to-speech devices, and magnifying devices. An example of this is shown at the bottom right. Next slide, please.
And with that, that is the conclusion of our presentation. So thank you all for joining us along for this ride for exploring glaucoma, open angle glaucoma specifically, and all talking everything about from the structure of the eye to how the eye changes, all of it. We are really we really appreciate you all being here with us, and we hope that as you were following along with us, maybe we were able to learn something new. Maybe it might have been again about the eye anatomy, or it may have been about glaucoma specifically, or some of the disability accommodations that are out there to help those communities who face various types of visual impairments as a result of something occurring to them. So we really hope this was informative to you. And what we